I'm Sarah Warren, founder of the ARC Professional Group and Oasis Center for Wellbeing, where we think in terms of wellness broadly defined. We're mostly focused on mental well-being, although we're not limited to that. And we think a lot about the well-being not only of individuals, but also of organizations, including workplaces. Tonight's program is part of the Oasis podcast series that we call Survive and Thrive. What we'll be doing is listening to a conversation I had with my colleague, Dr. Doug Culbert, who's one of the most esteemed addiction psychologists in the city of Chicago. Conversation we had late winter, so during the pandemic, about how the pandemic has affected people's relationships to substances and how people can start to explore their relationship to substances. After that conversation, which is about a half an hour long, I will come back on live with my associate, Dr. Logan Stohle, and she and I will have a 15-minute conversation about her thoughts about how the pandemic has affected our relationships to substances, and also some concepts and attitudes that she thinks are helpful for us to try to cultivate, including a concept that I think is very intriguing called compassionate curiosity. So we'll have a little conversation about that. And I will now turn it over to Logan for just a moment, and then we will go into the recorded conversation with my colleague, Dr. Culbert.
Thanks, Dr. Warren, and thanks to everybody who's joining tonight. I look forward to our chat in about 30 minutes and sharing some more about, as Dr. Warren said, ideas around compassionate curiosity. So stay tuned.
So without further ado, I will announce our featured guest, Dr. Doug Culbert, who is also a clinical psychologist, as am I, and we've worked together for years. He is officially a member of my practice, providing alcohol and drug assessments and doing therapy on alcohol and drug-related issues, as well as whatever else one might be concerned about, either including alcohol and drugs or not. So I'm delighted to have him in the practice. He spent the bulk of his career at University of Chicago Student Counseling, where he was the designated alcohol and drug expert. So he has many years of experience working with these issues and doing a lot of work in a way that I really think of as exploratory work, as opposed to work that's really more about kind of pigeonholing people in their relationship to alcohol and drugs, which is part of why I invited Doug. So welcome, Doug. Thank you for joining us.
Oh, good evening, Sarah. Thanks for having me.
So I want to start with the problem. Alcohol and drugs have been with us forever, but we have this very particular set of conditions that we're living in now, this protracted pandemic, winter coming on. So why would it make sense for us to be talking about how people might be relating to alcohol and drugs at this particular moment in time?
Well, first of all, I just have to say that this topic, or the pandemic, has just been sucking up a lot of therapy time in the last 9 months, and with all my clients and patients, and I found it over time really. I keep referencing back to this notion from sociology of the third place. Sociologists like to talk about the first and second place being home and work, where we spend most of our time, right? But the third place is all the other things we do. The third place might be a bar. It might be, your church or synagogue or your athletic club or a ball game. It's what we do, outside the home when we're not working. And it's really important. And yet the pandemic really has largely removed the third place. And since we're all working from home, or so many of us are, it's collapsed the other two. So we're all just kind of at home a lot. And really faced with a lot of stress and boredom. And of course, substances help with that. That's why we call them mood-altering chemicals.
So I really like your concept of collapsing the first and second and leaving us with just one place, basically. So if we think specifically about that aspect and how that might contribute to being a kind of setup for people to possibly smoke weed more, open another bottle of wine, have more quarantine hours over Zoom. What would it be about that particular feature of what we're dealing with that might be an invitation?
Well, I think that, alcohol and likely, I think marijuana too, which is, of course, now legal, have been really active parts of our socializing and gathering with people forever, certainly alcohol. And indeed, we're seeing the numbers that suggest that the pandemic has been correlated or combined with more alcohol use. Numbers from the CDC in September indicated that, we're drinking more often and in greater amounts. And actually, it's a little bit worse for women. I think it's we're trying to change how we feel, and we don't have, when we're at home, we certainly connect with people, Zoom, for example, but we don't have a lot of the familiar reference points that might regulate us and help us to sort of keep track of how much we're drinking. We don't have the bartender coming around for another round. We don't have other people directly there who are sort of modeling their drinking, and we have to, compare how we're drinking with them. And so it's kind of a setup to just maybe have one more, I think when we drink, well, first of all, let's think about, who are the people who might be encountering this, and it's really, we have recreational users, most people, studies for decades have really shown that about 90% of Americans drink at some point in their lifetime, and at least over half of Americans have had a drink in the past month, but then we also have people who have, really have substance use disorders, who are using in ways that are complicated for them and get in the way. And we also have people who aren't using, who are in active, stable recovery, abstinent recovery from having a problem in the past, but they're kind of faced maybe with less structure and less of their supports to keep from relapsing. And so, a variety of different kinds of people encountering this in a lot of different ways.
Mm-hmm. And what specifically about the pandemic? One of the things you just mentioned is that, if somebody's in recovery, they might be more isolated from their supports, particularly social supports for their recovery. What other aspects, if we think about sources of stress, sources of anxiety, uncertainty, that are peculiar to this really challenging time we're in, might make people more likely to say, why not have some more wine or another cocktail or another edible?
Well, so there's the low-hanging fruit. There's the things that are, boldly in our face. People have, are under economic stress and they're more isolated. And so, we're just more likely to do it then. But I think you also mentioned, when you said you were talking about stress, we think of stress being kind of bookends with anxiety. Anxiety is often a part of stress. And, when we think about anxiety, it often has a quality, or a component of anxiety is feeling out of control, or like we don't have control over something. Oh my God, we've had so much control taken away from us. We can't predict when this pandemic will be over or what will change it. We can't totally predict whether, what our risk factors are. People might go to great strides to be safe and engage in all the recommended behaviors, and yet, they know they aren't fully protected, and so they're just left with, I think, a higher level of baseline anxiety. And alcohol and edibles and will take that away, at least briefly.
Mm-hmm. So one of the phrases that I used in the beginning was relationship to alcohol and drugs. So I didn't talk about classification, right? I really talked about it more in terms of the language of like, we all have a relationship to alcohol and drugs. Even if we don't, I always say, you know, even if we don't drink or do drugs at all, we still have a relationship to drugs and alcohol, which is one in which we don't use them. So it's just such a predominant part of our culture that we all have a relationship to drugs and alcohol. And I know you use the phrase relationship to alcohol and drugs. I may have even learned it from you. I'm not sure. So why do you conceptualize us as having a relationship to alcohol and drugs, and why is that important in terms of things like stigma and labels and that kind of thing?
Oh, there's like, I think 8 questions in that. But maybe a starting point would be to just, you know, reference how, you know, substances like alcohol, mostly I think we're talking about tonight, talking largely about alcohol and marijuana. You know, these are substances, the use of which just gets woven into how we organize our lives. You know, think about all the references, the touchstones for just drinking alcohol. Here we're at the holidays. We have particular kinds of alcohol for different holidays. We have traditions that involve drinking in different ways. You know, college students, in an ordinary year, college students would have come home 2 weeks ago for Thanksgiving and gotten together with all their friends in bars to drink. You know, that's a tradition. And so they're just, as we go through our day-to-day lives, there are all these little kind of reminders that, oh, here's a time when we could drink, or here's a time that we might, you know, use cannabis together. You know, and so it's just become very woven in, I think.
And one of the things that I think about in terms of all of us having a relationship to alcohol and drugs is that those relationships are not fixed. They're fluid. They can change over time. We can reduce the amount that we consume alcohol and drugs at a given point in time. A lot of times people do more alcohol and drugs in college, and then it just sort of naturally starts to fall off for most people. Once people get out of college and into the workforce. And that doesn't necessarily even take a lot of effort. Other times people decide that they want to reduce their use or discontinue their use, and then sometimes they go back to using it. So I think of it as a very fluid relationship, and I think that fluidity is part of kind of what we get to play with tonight, is that this is fluid. It's not static, and it's something over which we have agency.
Right. And I think it's important, as you say that, to also keep in mind, you know, for that part of our population that really have active substance use disorders, and by my reading of tons of statistics, I think it's fair to say that that's really less than 10% of the population at any given point, and maybe significantly less. But that means that most Americans, those 90%, you know, at some point are using alcohol, and yet, you know, fewer than 10% of drinkers have problems with it. That means that most people kind of have figured out a way to like know when to stop, or they sort of have their limits, and it just kind of works for them. For people who have substance use disorders, they really need to be more intentional. They need to be more planful and pay attention. In general, I say that to people all the time when we're assessing use disorders. But during a pandemic, I think we kind of all have to be more intentional and pay attention, because we're kind of in a new room. We're in a new space of using substances in ways that, and at times that, are less familiar to us. And that's when we can, you know, that's when we get into trouble, or when we might, you know, do things we wouldn't ordinarily do, because we don't have the regular compasses, I think, available to us.
Yeah, I think compass is a good metaphor. So let's say somebody wants to start to explore their relationship with substances. How would you suggest that somebody start that process?
You know, my answer is different tonight than it would have been 8 months ago, because I've been learning a lot from the people I work with. And one thing I've learned is there are a lot more resources online for people. There are, and not just online AA meetings, and there are tons of them, but I mean just for exploring things. There's a sober curious movement that people can look up. There are subreddits on Reddit, if you know what that is, and I just sort of know, but these are like social texting sites, where people share and exchange information, and there's a lot of communities out there who are kind of sharing their experience of beginning to look at things. So that's one answer, or maybe that's one piece of the answer. I think that more broadly, I think like with anything else, it begins with kind of paying attention, observing your rhythms of use, thinking about, considering changes, just maybe deciding, that, well, maybe I won't drink for a certain amount of time. That might be days or weeks. And I'm not saying everybody should do that, but when people do that, I think it can sometimes be enlightening. They sort of see all the correlations of the substance into the rest of their lives, I often have thought
so
that.
Go
ahead. Mm-hmm.
Go ahead. No, go ahead.
I was going to say that I've often thought that alcohol use, for example, would be so much easier to understand if it was grain alcohol in a clear glass in a white room. But it's not that. We have a zillion flavors and labels and places and traditions, and so it's a very complex behavior, and that means there's stuff to look at and look for.
Mm-hmm. So one of the things I'm thinking about, that somebody might, as a process of exploring, as part of a process of exploring, somebody might make a decision to make a change. And I think that sometimes people assume that making a change indicates that there's a problem that needs to be addressed by making a change. And I think that you're suggesting something different, which is the possibility that you could say, I'm going to try changing my relationship to alcohol or drugs in order to better understand it.
Right. And maybe also to enhance one's sense of agency. I think you used that term earlier. When somebody says it, sometimes we'll hear, I can quit any time, whether it's cigarettes or alcohol or anything. I get suspicious that really that would be pretty difficult, because I don't think they're very aware of, how complex it is. And so somebody could just begin by paying attention, or maybe making some choices to change up how they're using, just to observe, because I think the goal would be to be more in charge of the choices that we make, not only about alcohol, but maybe about exercise and the food we eat, and all the things that we do in our life, we're doing in other parts of our life. I think we can do it with substances.
Mm-hmm. And you mentioned in passing at the beginning that marijuana is now legal in Illinois. And do you think that changes in any way how one might look at one's relationship to marijuana in specific, or not? Do you think that doesn't change?
I do think it changes, and I'm sure, Sarah, that being in the field that we're in and with this specialty, I'm sure you've had the question many times. Well, what do you think about this whole legalization thing? Is that a good idea? And I wasn't sure whether it would be a good idea, and I still have mixed feelings about it. I think there's a lot of positives that could come out of it. That's a whole longer discussion. But one thing that is true, I think, is by taking away the kind of the legal part, it really puts us in a position where, on an individual basis, we're maybe more free to assess and make decisions that are safe for us, that make sense, rather than just bumping up against whether it's legal or not. It's a choice like other choices that we make, and some people will find that it's not helpful to engage in certain ways with certain substances, and others find that they can do that, and they feel like it's a useful thing without costs that offset the value.
Mm-hmm. Yeah, I do think it's a complex question. I don't think it's a black and white question of sort of, is it good for people's health, for instance, that it's now legal. Right. And I think similar kinds of issues arise with medical marijuana. in my mind, there's not really a big question about the medicinal value of marijuana. I think that it can be very therapeutic for certain conditions. And at the same time, I think that, medical cards get abused.
Yeah.
And even now, I think they do, is my impression.
Yeah.
So what if someone's self-assessment is that, in fact, maybe they are drinking or doing more drugs than they were before the pandemic, and they've decided that they want to try to get it more under control, whether it's deciding to quit for a while or maybe quit indefinitely or reduce? How might somebody approach that? They've made a determination that they want to make some changes. How might somebody move forward?
Well, I would start by saying a little bit more about why they might do that, and what might be the value of stopping or changing. Sometimes I think it's helpful to sort of consider the concept of maybe composing an equation to explain. You can tell I've worked with a lot of UC students, but an equation to model your drinking behavior. And I'm not suggesting people do it, but if they did do it, it would have a lot of variables, a lot of things that contribute to their drinking. We drink to change our mood. We drink out of habit. We drink to enhance things socially. We drink for its social lubricant value. It's going to be different for different people. But when someone does stop, all of the variables in that equation that are contributing to the thought to drink start to lose their valence or their value a little bit. We might even say we begin to be more clear-headed about the reasons why we drink. And so that's a really good reason to consider a change, right?
Mm-hmm. So I think, I don't want to impose this on what you just said, but I think that in there might be a case for doing something like saying, I think I'm going to not drink or do drugs for a certain period of time because I will be clearer-headed, not just in general, but about my relationship to alcohol and drugs.
Right. And if we had more time, we could talk about why that is and why that changes. And there's really interesting, information about neuroplasticity and learning and unlearning. Mm-hmm. But the short statement is, we do get clearer-headed about our relationship there. And then if we go to your question about how might one do that, I think that the simplest, maybe a simple starting point is to think about intentionality and being planful. If you're gonna change your drinking, you got to pay attention to your drinking, and think about, whether you're going to stop altogether for a certain period of time or whether you're going to, change the amounts that you're drinking. If you're changing the amount, then you have to have a way to count, to keep track of how much you're drinking. Counting alcohol if we talk about alcohol, is tricky. If you just think about the easiest way to count your alcohol is to drink bottles of beer. It's in a unitized format. You can line the bottles up in front of you. But if people are mixing your drinks or you're drinking, ale versus beer, there's all these different things that make it hard to keep track of how much you're drinking. But that's not a deal breaker. It just means you have to pay close attention. Anticipating when there might be drinking opportunities. So you can, plan ahead to know, okay, I know there's going to be alcohol in this event or at this, I could drink during this Zoom chat. What's my plan for that? Always being intentional, I think.
Since we're close to the end of our time anyway, I will open up to see if we have anybody who wants to pose a question. You don't need to identify yourself. Feel free to ask anything that would be of interest or help to you. Anybody have any questions? Okay, sounds like we don't. So we've talked a lot about the sort of exploratory process, the investigation, the self-assessment.
Mm-hmm.
And what if somebody decides they're really in trouble? They try to cut back on drinking and they go into withdrawal. Or, we haven't talked about drugs other than marijuana, but let's say, we're talking about opiates or other drugs, where you can die from an overdose.
Right.
So what if somebody really thinks, I think I really need to get some help here?
Right. Well, if somebody is if anybody ever feels like medically unstable, then of course they need to go to an emergency room, and there's a lot of value in doing that. If you're in withdrawal or you've overdosed, there's a lot of assistance there. So do that. Call 911. Go to the emergency room.
Both of which can be fatal.
Exactly. Yeah.
So either an overdose or withdrawal can be fatal.
Yeah.
So it's it's not always, but it's better to be safe.
Right. Now, assuming that's not some active acute risk, I think if you're really wondering, am I having a problem here? I would contact a mental health professional and get a good evaluation. And I think sometimes people get kind of freaked out about the idea of, I don't want to go talk to a professional. But really, it's a way to have a conversation that's structured and informed that can help you kind of make sense out of what we were calling, your relationship to this substance, to see are there consequences associated with the way I'm using these substances that really go beyond what I'm willing to accept and feel capable of containing. And that conversation can then lead to identifying the degree of a problem, if there is one, and identifying the range of options available for the individual.
And one of the options that might pop into people's heads right away would be something at the highest level of care, which would be like going to rehab, right? We all have kind of a schema for that in our heads, and we hear about celebrities going off, to Malibu, for a month. So there's that end of the continuum, but there are other points that are not as intense as that.
Entirely,
what other options?
So I think that generally if somebody's use is kind of out of control, I tend to lean towards at least initial phases of abstinence for people, and therefore that helps me to think about what are these different levels of treatment, and certainly residential or hospital treatment is going to stabilize you medically. Residential treatment is going to give you a lot of treatment, but also kind of make it more difficult for you to use. But sometimes that's really excessive to have to go live somewhere. Somebody might go into, say, a partial hospital program where they attend treatment several days a week for a few hours. They're getting a lot of the same treatment, but then they go home at night, or they can go to work during the day and then circle around during part of the day or week for this higher level of care. Or it might be, working individually or in a small group with people. Similarly, if that's enough to help the person to get through the day without using, then that sort of contains them. If that's the only thing your treatment does is keep you from using, of course, it's not going to be, you can never leave treatment. So treatment has to be a modality of change. And that could happen in any of those degrees of extremeness. I don't know.
So I think that's useful to kind of have people have in mind that there's really a range from even at the probably I would call it the least intensive would be doing something like going to a self-help group, right? Where you're not really getting professional help, but you are seeking help from peers, and then there's one-on-one therapy like you and I do, and then there are formal treatment programs that can be at different levels of intensity.
Right. And a lot of the group level stuff, and of course individual therapy right now, in fact the whole continuum except for going to the hospital, is being provided in some fashion online right now. So the fact that we're all stuck at home and maybe don't feel safe, say, going to a facility, there are options for treatment right now.
That's a really good point. Yeah, I'm glad you said that, because people might have the notion that such services are not available during the pandemic, and they very much are.
Yeah.
Welcome back, Logan. So we've all just listened to the conversation between me and my colleague, Doug Culbert. And part of that conversation was about how the pandemic has sort of altered the conditions of living and has had an impact for many people on how they relate to alcohol and drugs. And so, Logan, I wanted to ask you what you would add.
Mm-hmm. Yeah, I'm thinking about people that I've worked with during the pandemic, people that I know, many of whom experienced an intensity or kind of an increase in intensity of whatever mental health concerns, struggles, or way they were relating to substances. These things all kind of increase in intensity. So people feeling more depressed, more anxious, people finding that they wanted to rely more heavily on drinking or using cannabis or other kinds of drugs. I think because there was an experience of isolation and uncertainty, it kind of narrowed the window for what we were able to do, what we felt could soothe us, allow us to feel some control, some comfort. And I think that's where substances certainly played maybe even a more significant role in people's lives. Yeah, I think as we're, I'm curious about this new phase as we're coming out of this year or more of kind of uncertainty, isolation, and loss, how people may be thinking about, for instance, their relationship to substances, if it changed. And because life is, going back to normal in some ways, so to speak, what kinds of considerations, curiosities they're having about that way they're using different substances. So yeah, I think about like where we've been and kind of where we're going and how that all connects to the way we're relating to drugs and alcohol.
So I think that's a perfect segue into this notion that you have, that there's an attitude that we can bring to bear to an exploration of our relationship to substances, which can be our current relationship to substances and our past relationship to substances. It could include, I decided I want to look back on, not just, college or how I'm using now at sort of two ends of the continuum, but I'm going to look at, my relationship to substances more recently. So there can be a sort of reflecting back as well as looking at the present time. But you have this idea about how we can bring compassion and curiosity to this process of exploration. And what do you mean by that when you talk about compassionate curiosity?
Yeah, this feels really important to me because I think from what I've witnessed, what I've seen in people I've worked with, what I've seen from people in my life, there can be obviously a lot of stigma around the way that we choose to use substances. Stigma that we can experience internally that comes from people in our lives, from the messages that we get about how we should or shouldn't use something. And this can leave us feeling shame, guilt, confusion, which I think can lead to wanting to isolate or kind of to sequester that part of ourselves, to hide that part of ourselves, and not seek out an exploration or like just a self-reflection or gaining support from other people. So I think compassionate curiosity feels really important in this context because to me it means being curious about your relationship to substances in a way that is not judgmental, that's not seeking to diagnose or pathologize immediately, but is instead trying to open up a space to ask, what is the meaning in this relationship for me? How is it serving me or not serving me? And how did it come to be? You know, how do I understand the way it's evolved? And I think part of the way I would understand bringing in the compassion is using some of the tenets of mindfulness, you know, which has obviously a legacy within Buddhism for one place, and it's certainly been adapted in the mental health field. But using mindfulness to me would mean exploring, asking these kinds of questions and leaving space to just be aware of our own reactions. You know, if I ask myself, what's the meaning in this relationship? And I notice immediately wanting to judge or feel critical or react, can I leave some space to just be mindful about that, to be present to that feeling and keep engaging and kind of affirming being a part of this process and using tools to do that in the moment.
So part of what compassionate curiosity represents then is kind of an antidote to someone's own self-criticisms, which often I find in my work can be quite harsh. There's also social stigma, right? That society where particularly drugs in general, marijuana less now as it gets legalized more in more and more places. You know, that's changing, but in general, drugs tend to be, I think, viewed in a more critical light. So part of what you're talking about is kind of an alternative perspective, an alternative attitude. And what about in relation to experiences people may have had in either considering getting professional help or encounters that they've had in rehab or treatment programs? How does compassionate curiosity in your mind relate to some of that kind of that climate?
Yeah, I think about two things. One, that engaging compassionate curiosity could be a step that somebody takes before deciding to engage in therapeutic services, medical services, seeking help. It would be a way to ask yourself and develop the ability to say, what are the things that I need? What are the choices I want to make based on this deeper understanding I have of my relationship to substances? So I would hope that it would help people make more informed decisions that could feel empowering. But, you know, as we've seen in our work, people who do have to engage support through treatment centers, through gaining medical services, can experience what feels like judgment, what feels like kind of an immediate reaction of criticism to their relationship to substances and how they're trying to understand it. And that leaves people, I think, it can leave people feeling hopeless. You know, here I am trying to be vulnerable and ask for help, and yet I'm met with a reaction that can feel dismissive, invalidating, and sometimes even harmful. And I think it can also be hard, you know, once you're engaging in treatment, you know, there's sort of the pretense that you have a problem or an addiction or a problematic relationship. And once you put things into that context, it can be hard again to want to engage vulnerably and to take a compassionate stance toward yourself when you're holding this as something that's problematic and that others may be reflecting back to you as something you should just stop doing. So that's how I think about the question you asked.
And that you might be judged if you go to seek professional help and you're not prepared to commit to stopping, right? So, you know, people enter treatment programs and get discharged because they're not agreeing to a commitment that they're often asked to make up front. And I think also sometimes there's not a lot of room for people to be ambivalent in treatment, or to sort of say, well, I know I need to give up alcohol, but I really want to keep the weed. These are all things that can lead sometimes to a program sort of saying, well, then, you're not ready for what we have to offer. And then this all ends up being an obstacle to people getting help that maybe they had to overcome sort of personal internal hurdles to get to the point where they were, willing to make that phone call and do that intake. And then, they have experiences that can leave a bad taste in their mouth. So I'm just struck by that as kind of also a correction, if you will, that you're wanting to make, is to create room for people to be able to say, yeah, I am ambivalent, I am uncertain, I don't really know where I want to go with this, that kind of thing.
Yeah, I'm thinking, just to add to that, this stance of compassionate curiosity could help normalize the ambivalence, which is such a normal part really of any relationship, our relationship to work, to our friends, to our family. There's ambivalence that we're always trying to understand and work with. And of course it would come up in a relationship to substances, especially if at times it's been a significant coping tool or something that provided meaning. And so again, I'll just say, I think normalizing that is crucial, and leaving the space for that is crucial.
So you're going to be leading an educational program in June. I'm sorry, in July.
Yes.
So tell us about Come As You Are.
Yes, so Come As You Are will be a program. The tentative date is July 8th through the 29th. So it'll be 4 weeks, 4 meetings, 1 hour long, 7 to 8 p.m. And it will begin with a focus the first week on cultivating compassionate curiosity, understanding more about this stance through reflections that I'll offer that people can engage with. Questions like, how do I understand the meaning of this relationship? Questions about the way you engage, the set and setting. Questions about the messaging that you've received from family, friends, media that inform and influence this relationship. And we'll weave in the first week and sort of throughout tools to sit with the feelings, the thoughts, the sensations that come up as we're trying to engage this curiosity. So the first week will introduce the deeper reflection. And then the second and third week will be more to provide tools that people can use for reducing tension, dealing with distress. These are things that can obviously come up in a relationship to substances, could be the reason why we're using them a certain way, but also tools for promoting relaxation, comfort, pleasure, wondering about alternatives or just additional ways we can grow those parts of ourselves or sort of lean into things that feel comfortable, relaxing. And then the final week will involve setting an intention for folks who may want to be making a change or thinking about it, leaving some space to set intention for the future, and sort of helping us also be intentional, thinking about how to be intentional about maintaining this compassionate, curious stance moving forward in our lives.
So when we send the follow-up email to all of you who have registered, you will get the recording for this, and you'll get the registration link for Come As You Are. And you also, as a gesture of appreciation on our part for your participation tonight, you'll get a discount code. The discount code is good through this coming Friday, so a couple days. At some point, we may also come back to all of you who signed up this evening and say, you know, what do you feel like you need? You know, what kinds of programs, what kinds of services would help you, either personally or if you're a mental health professional, and we do have a fair amount of participation usually in our programs from fellow mental health professionals. You know, what would help support you in your work. So we may reach out to you and ask for your input so that we can figure out how to design programs and services that best meet your needs. So we will also be doing a 1 hour more in-depth kind of preview of this program, the Come As You Are, in June. It will be Thursday, June 3rd, in that 7 to 8 p.m. Central Time window. So we will send that information to you once we've created the registration, and we hope that you'll join us for a deeper dive in a few weeks.
Yeah, looking forward to that.
Thank you, Logan.
Thanks.
Thank you all.